This is a special edition of Late Night Health. I'm Mark Allen. We're going to be speaking with another Mark, Dr. Mark A. Smith. He's not only a medical doctor, he also has a Ph.D., and he is the Chief Medical Officer for Vistagen Therapeutics, and they are based in, they're based in South San Francisco?
South San Francisco, correct. Yep, in the Bay Area.
In the Bay Area, and I'd go there, but with social distancing, we can't. There's a new drug coming out. Its current name, and I don't even know, this is not going to be sold under this name, I wouldn't think, but it's called PH94B. It's a neuroactive nasal spray for social anxiety disorder, or SAD. Doctor, welcome to Late Night Health. I'm really curious. Right now, everybody is socially has anxiety.
Yes.
You and I were just talking before, about grandkids and not being able to see them. That's got to cause anxiety right there.
Yeah, everybody's under scrutiny, aren't we? We're all, behind the mask and suspicious of one another, whether we're contagious or not. So yeah, there is quite a bit of social anxiety out there, and paranoia in general about this unseen, virus that's affecting us all. So, people with true social anxiety disorder are quite a large group. Almost 7% of America may be affected by this. Now, these people are hunkered down like many of us and aren't socializing out there. But one day, hopefully soon, we'll get a vaccine here, and we all will, be out there once again. And this group of people are very fearful of social interactions. They feel like they're under scrutiny and people are judging them. And as a result, they avoid social situations and often just don't live up to their full potential. And, these are people who range from, CEOs of companies to, people, who can barely get out of their basement because they're so fearful of social interactions. And so we're very interested in developing some new medications for these people.
The number of people, that's an amazing number.
Yeah.
I mean, it's almost 10% of the population. It's like 30 million people or close to it. How do we, hold on one second. What has been the standard to help these people with SAD?
Yeah. So there's been both pharmacological treatment and non-pharmacological. So the psychological treatment is called cognitive behavioral therapy. It's a dialogue between you and your therapist, to sort of challenge your assumptions and look for different ways of, dealing with, in this case, your social anxiety. And it's a series of sessions, with your therapist. Now, these days, it can sometimes be difficult to see your therapist. And although a lot more we are doing a lot more telepsychiatry, telemedicine than we ever have before, which I think is a very good thing. And there are some digital platforms to do that. But still, it takes a lot of time. And some people want relief from their anxiety much more quickly. So traditionally, people have reached for benzodiazepines, Valium, Xanax, are some of the trade names. These drugs definitely work. They work quickly. Unfortunately, they come with a lot of baggage and a lot of side effects. I mean, I'm sure people are familiar with the opioid crisis, people getting addicted to opioids. There's a analogous benzo crisis now too. A lot of addiction to benzodiazepines. These are addictive drugs. People become tolerant to them. They need higher and higher doses, and it gets very difficult to get off of them. So great drugs for very short-term use, a week or two, a month at most. But when you get on it longer, lots of baggage. So I don't see that as a great option for this disorder, especially because this may not happen every day. It happens when you get maybe have to give a talk, or a speech or something like that. So you want something that, relieves your anxiety more quickly, acutely. People do resort to, blood pressure drugs like propranolol. Those are not addictive, but they do have some side effects, make you dizzy, and they don't really relieve the anxiety very well. People also take antidepressants, but again, you have to take them, every day for months on end. And people don't really, like that solution very well. So I think there's room for alternatives.
With the new drug and PH94B, I wonder if there was a 94A and there'll be a 94C. But with this new drug, will there be that dependence, or will it be something that people can use for a couple of months and not have that addictive part of the solution?
Mm-hmm. Yeah, we do not believe it will be addictive. In fact, it's not even sedating the way benzodiazepines are. So when you have to go into a social situation or even a situation at work where you really need to be alert, with it, this is the kind of drug we think that will be useful in that situation. We have no indication it's addictive. It doesn't make you high, doesn't make you sleepy. It works completely differently than oral medications. We actually spray it into the nose, the patient themselves, when they feel the need, they feel they're, getting anxious about a situation at work or a party, or et cetera. So they take a spritz into their nostril, and within 15 minutes, they feel a reduction in their anxiety without feeling sleepy, without feeling high. So we think this drug will be very safe to use. And the reason we think it's so safe is because we're essentially spritzing it right on to where the receptors are in the nose. pH comes from pherin or pheromone, although this isn't exactly a pheromone, which is, a small, chemical that's, transmitted from one animal to another, usually to increase your sexual.
I was gonna say there were over-the-counter
yes
supplements a number of years ago. You want to attract a lady, you want to attract
exactly
a guy, right? Use the pheromones.
People put those in perfumes. So
yes.
it's a concept like that, but these are not pheromones. They're actually odorless. They have no odor, but they do transmit a signal from your nose, from the olfactory system in your nose back into your anxiety centers of the brain, the so-called amygdala that is involved in your fight flight. And so this completely novel mechanism was discovered by Dr. Louis Monti several decades ago. We synthesized a number of compounds and found one that really seems to relieve that anxiety acutely, safely, without even getting into your bloodstream, directly from your nose to your brain. So yes, we think these are going to be very safe, compared to what's out there now.
I think there are basically two kinds of people in the world, and I'll break it down. I'm going to use a food analogy, something I do a lot of. When I'm thinking about traveling, before I book my airfare, before I book my hotels, I want to know where I'm going to eat dinner. If I'm coming to Maryland, I have a certain number of restaurants where I'm going to go. There's a place for crab cakes that is just phenomenal in Silver Spring. It's been there apparently for 60 years or 70 years or something. And that's how I am. So I'm in quote, a foodie. Then there are other people who just eat to live because they need fuel. They're using that analogy. There are people like you and me who were told, go up and talk to that group of people. There's 4,000 people in the room. It's okay. I'm assuming that you're like me and that has no effect on Mark A. Smith. In fact, you enjoy it. I do. Why do people have these that problem in speaking. It's
Yeah.
so public speaking is like the number one problem facing business people.
Exactly.
Right. And they would rather die or have a limb cut off than do it.
Yeah. It's a good question. And I think the simple answer is often it's something you're born with. Social anxiety disorder often manifests itself in childhood, certainly by adolescence. There actually was an interesting study done recently where they noticed that kids who are shy, as infants, don't want to interact as well with adults. They grow up as adolescents to be, socially stressed out, in certain situations like public speaking, and in adulthood, manifests full-blown social anxiety disorder. Interestingly, when they feel they're under scrutiny or they make a mistake, let's say they have to do some tricky math in front of an audience. You can detect that on their EEG and actually detect that they are sort of self-aware that they're, making a mistake and people, might be scrutinizing them. And so the short answer to your question is you're probably born with this. There's a certain percentage of us that are just, more attuned to feeling they're under scrutiny. Yeah.
If I had to get up in front of a group and do a complicated math thing, I would have a problem with that. In looking at other drugs that are out there, should we be, and that's society and particularly doctors, should they be more careful in prescribing some of these things?
Yeah, I think they should. Let's look at benzodiazepines. When Valium was discovered, Mother's Little Helper, people were prescribing that stuff like, candy. Now we now know, that it is addictive, hard to get off of. And I can't tell you how many elderly, I'm a psychiatrist, I can't tell you how many elderly I see that are still been on that drug for 40, 50 years later. It's ridiculous. These drugs were meant to be used short term. Now, but a lot of people, over half, are still taking this drug chronically. I think the psychiatrists recognize what a problem it's been, and there's been a real backlash against prescribing benzodiazepines among psychiatrists. Primary care docs, though, are still prescribing them. In fact, they're the ones who are prescribing the most scripts for benzodiazepines. And I can certainly empathize and understand why. I mean, primary care docs these days have 5 minutes, 10 minutes at most to, understand all that's, physically and mentally wrong with their patient. And, people want quick relief. So they sign that script and give them the benzodiazepine. They get quick relief, but then they keep coming back for more and more. So, yeah, I think they have been overprescribed, and that's why there's such a need for an alternative out there.
And it'd be the same thing with opiates. Doc, my back.
Exactly. Exact same analogy. We have the opiate crisis. Now we seem to be developing a benzo crisis. Yep.
Well, we've just established that Americans in general, I guess, are over-medicated. And patients need to know, because they go to their doctors and they want, as you just said, immediate relief. I mean, nobody wants to have pain. We all have, exactly. You and I are maybe a little bit over the age of 35, and we've had, back pain, for example. Almost everybody, even millennials. Yes, millennials, you will have back pain. I guarantee it. If you get an opiate, you have a chance of actually further injuring your back, for example, because you feel so great. Oh, I can play basketball. And can you respond to that?
Well, sure. I mean, let's take another analogy, which is steroids, for, I recently had to take a bout of steroids for another ailment, and I have, a lot of osteoarthritis because I am quite a bit beyond 35 years. Never felt better in my life. All my osteoarthritis was gone. But can I take that rest of my life? Of course not. I would have all kind of other, problems as a result of the side effects. So I think people, when I trained as a physician, opioids were not given except after surgery or, with end stage cancer patients who are in chronic pain. Then, don't get me on this, but, we started, advertising that this, is great for toothaches and back pain, whatever, whatever ails you. Obviously, strong medicines, have strong side effects, and we should look for alternatives. Now, coming back to anxiety, there are some alternatives out there that might be worth considering. We talked about, psychotherapy, cognitive behavioral therapy, which can be done online. A lot of people now are turning to cannabidiol, CBD oil.
I just wrote that down to ask you. We're on the same wavelength.
Yeah, I think there actually is some good animal evidence that works. I mean, half the dogs in my neighborhood are on CBD oil, especially with the July 4th fireworks. They've all been on their CBD oil this past weekend. But I think actually there are a couple studies, not too many, but there are a couple studies in humans that well done that actually it does relieve some anxiety. So there are some alternatives out there. And I think, we at Vistagen feel that, any new drug that we bring out for anxiety has got to be simple, free of most side effects, not sedating, doesn't cognitively impair you, and can be used either intermittently for months on end. That's important.
And I have to ask, we have CBD, but there's also, the grandfather of CBD, which would be, pot. I'm the only guy in this who grew up in the 60s who, as far as I know, didn't imbibe. I don't like, I didn't.
Yeah.
I have used CBD. Sometimes it's effective, sometimes it's not, depending on the strength. They need to do more studies on this.
Yes, they do.
And they do use it more and more for pain relief for, say, advanced cancer. And they should have been doing that for 70 years, but
yeah.
Well,
as you know, pot, probably contains dozens, if not hundreds of chemicals in it. And so you're right. I think a lot more research needs to be done, but I think some of the metabolites, like CBD, may have some important uses.
And as we wrap up, there's our time together. When will the product be available for those suffering from social anxiety disorder?
So we've, we're in our final stage of testing, which is called phase 3. That's where we do our large studies in social anxiety disorder. Unfortunately, with COVID-19, it's a little difficult to do those studies. It's hard to ask people with social anxiety disorder to get out there and try to socialize. And it's particularly difficult to do that now in the midst of this pandemic. But we're planning on restarting all our trials in phase 3 spring of next year. And we hope that, that'll take about 2 years to wrap up those trials. And then we'll try to get it on the market after that. I should also say that, we are looking for other disorders that this drug might be useful in. So we are going to do a couple little experimental studies. We're hoping to start one this fall in New York City with people who have so-called adjustment disorder. Adjustment disorder is sort of an exaggerated response to a stressor or just not functioning as well. And we're actually going to do this study in New York with, which really was the center of the pandemic here. Maybe not so anymore, but still a lot of people are very anxious about COVID-19, both economically and, when things are going to come back to normal. So we're going to test our PH94B and those subjects as well, who are very anxious, about this whole pandemic, to see if this drug could be useful in things beyond social anxiety disorder.
Well, I have a disorder that you should take a look at. It's called radiotibiitis. It usually hits somebody in their early 20s, and once you have it, you can't get rid of it, and you end up spending 30 plus years talking to people. So if that's something that you could look at, you might be able to make a lot of money with that one.
I'm not sure we'll cure you of that, but we'll see.
Well, I hope you've enjoyed our time together. If somebody's interested in learning more about Vistagen Therapeutics, and particularly the new product, PH 94B, is there a website where they could go?
Yes, we do. Just look up Vistagen Therapeutics and .com, and you'll see you can click on our products and that are in the pipeline. We actually have some very nice videos that show how we think this drug works, in this intranasal formulation, and there's quite a bit of information on there, and about social anxiety disorder as well.
Got it. And we have had your website up underneath your name throughout our conversation. I
Excellent.
Just wanted to have you repeat it. Thank you. Will you come back as the studies come in?
I'll be happy to. Yeah, happy to report our progress. And it's been a pleasure talking with you.
You too. Hold on. I'm Mark Allen. This is Late Night Health. Be sure to join us at our website, which is latenighthealth.com. We'll have a pretty picture of Dr. Smith on our site, and also more information about him and about PH94B. We'll be back very soon. Bye-bye for now.